lives. This is Consumers Doctor on the behalf of Foremost Organization. Today's topic is don't be fooled. Yes, don't be fooled. It doesn't take a rocket scientist. Political health reform proposals are typically very confusing on purpose. It is a political sleight of hand. So don't be fooled by politicians and health industry lobbyists. They try to sound smart by purposefully making things complicated. One trick they use to point out the finger of blame at someone else. Yes, we have a dysfunctional healthcare system, folks. Insurers blame hospitals and doctors, and doctors blame lawyers. Employers blame non compliant employees. Politicians blame other politicians, and so on and so on. The blame game goes on with no solution. Another trick, they use it to propose a comprehensive solutions. In 2019, healthcare spending represented 17.8% of our gross domestic product. Any industry that large has lots of lobbyists and vested interests. They suggest comprehensive reforms, comprehensive solutions include so many extra items that everyone is against some part of comprehensive plan. So nothing gets done. Nothing gets done. They assume that we are too stupid to understand details. They assume we are too stupid to understand the details. They use political shorthand like COB, CON, HDHP, CDHC, and many more insider terms to reinforce what we couldn't possibly understand the complexities of healthcare. They assume, I want to repeat that again, they assume we are too stupid to understand the details. They use industry and political shorthand like COB, like COB, CON, HDHP, CDHC, and many more insider terms to reinforce that we couldn't possibly understand the complexities of healthcare. It doesn't take a rocket scientist to know the difference between the health insurance and health care. While They're intertwined. Healthcare is when one receives the medical services from medical providers like doctors and hospitals. Health insurance is how one finances medical services. Health insurance reform should focus on private market coverages. Private market coverages. About 176 million Americans access healthcare through employer sponsored health insurance or though individual health or through individual health insurance policies. Whether it is employer sponsored or individual coverage, whether it is employer sponsored or individual coverage. We are all concerned about number one, cost of health insurance, number two, coverage of the pre existing conditions, and number three, out of pocket expenses. This is what it is, folks. This is what it is. So don't be fooled when they tell you that common folks cannot understand the healthcare complexities. It is always, they try to say, consumers or customers, Americans don't seem to understand the complexities of healthcare. That's not true. That's not true. As a matter of fact, as we sit here today, American healthcare system, it is so complicated. Instead of simplifying it, they deliberately make it complicated there. So for Americans, it's very confusing, folks. So if you do like this channel, subscribe, share, and make some comments and hit the notification button, folks. Thank you for joining. This is Consumers Doctor on the behalf of Foremost Organization on a channel called HIP, Health Insurance Personalized, so-called consumer-driven healthcare or personalized healthcare. Thanks again. We will see you next time. Goodbye.